So you're scheduled for a steroid injection for your low back, mid back, or neck. Maybe you're feeling a little nervous. Totally normal. In this video, I'm walking you through the 5 most important things to expect from the moment you schedule through the procedure itself, all the way to recovery. Go ahead and hit the like button and stick around until the end. By the time we're done here, I promise that you'll know exactly what's happening at every step. I'm Dr. Jacob Kneeman, board certified pain medicine physician, and this is Pain Explained. All right, first things first, preparation. This actually matters more than most people think. The number one thing that gets procedures delayed or rescheduled: blood thinners that weren't stopped in time. So here's the deal: if you're on aspirin or Plavix, you typically need to stop them 7 days before your injection, though this can vary depending on the physician you're working with and the location of the procedure. Medications like Eliquis or Xarelto, usually 3 days. But, and this is crucial, never just stop these on your own. You need clearance from whoever prescribed them, usually your cardiologist or primary care doctor. I've had patients show up the day of the procedure still taking their blood thinners, and we can't do the injection. Beyond medications, there are some simple things that'll make your day go smoother as well. Stay hydrated the day before and morning of, get a decent night's sleep. I know, easier said than done when you're nervous about a needle going into your spine. You can eat a light meal before. You're not going under general anesthesia, so fasting really isn't necessary. But check with your doctor's office because some practices have different protocols. And here's the thing people forget: often it is wise to arrange your ride home before the day of the procedure. You may or may not be able to drive yourself home depending on what was used in the injection or if there were any complications like numbness or weakness in the arm or leg after the procedure. Some facilities will literally cancel your procedure if you don't have a driver waiting, so lock that in early. Do these things right, and you'll feel calmer walking in, and you'll recover smoother on the way out. Now, let's talk about the procedure itself. The question I get asked most is, how much is this going to hurt? Here's the honest answer: there's a specific sequence of sensations you need to know about. First, we numb the skin with local anesthetic. That's the part that burns. It's a stinging, burning sensation that lasts maybe 5 to 10 seconds. It's uncomfortable. I'm not going to sugarcoat it. But here's the thing: that's the worst part. Once that numbing medicine kicks in, which happens pretty quickly, you shouldn't feel sharp pain during the actual injection. What you will most likely feel is a sense of pressure. It kind of feels like a deep sense of fullness, or kind of like a deep ache as the needle advances in your tissue. Some people describe it like someone pressing firmly on their back. It's usually pressure, not stabbing pain. Big difference. If you do feel sharp shooting pain down your leg or anywhere else, tell us immediately. That means we just need to reposition the needle a little bit. Communication during the procedure is a big deal. You're awake, you're able to talk to us. We need your feedback. Here's what the setup looks like. You'll lie on your stomach on an x-ray table. We'll attach some monitors, blood pressure cuff, maybe a pulse oximeter on your finger. Your back gets cleaned with antiseptic solution. It's cold, heads up on that by the way. And then we drape the area to keep everything sterile. Under x-ray, called fluoroscopy, we guide a needle into the epidural space. Then we inject contrast dye first to confirm we're in the right spot. Once appropriate spread of the contrast is confirmed, we inject the steroid mixed by itself or sometimes with local anesthetic. The whole thing start to finish, usually about 10 to 15 minutes. Some procedures take a little longer, while others are quicker. And then it's done. Needle out, band-aid on, and you're headed to recovery. If your injection was much more painful than what I've described, be sure to stick around until the 5th section to understand the acute flare-up. Now, after the injection, you're not just walking out the door. There is a recovery period. You'll rest for about 10-15 minutes, sometimes a little longer depending on how you're feeling. We're monitoring your vital signs and making sure you're steady on your feet, watching for any immediate reactions. Here's something that freaks people out: temporary numbness or heaviness in your leg. Though this can be totally normal, I reassure you. Remember, your doctor may have injected local anesthetic along with the steroid. That numbing medicine can affect the nearby nerves temporarily. So your leg might feel like it's not quite yours for an hour or two. It's weird, but it does wear off. This is why you might not be able to drive right away. Your strength and reflexes aren't 100% for a few hours if your leg is weak. Make sure you stick around longer before you go if you feel weakness in your leg or foot. Some facilities will give you crackers and juice because your blood sugar can dip a little from the stress and the procedure, so having a snack helps. Once the medical team clears you, your driver takes you home. Plan to take it easy the rest of the day. No strenuous activity, no heavy lifting, no bending or twisting. Just relatively hanging out for the next 3 days. You can shower the next day, but avoid soaking in a bath, pool, or hot tub for at least 48 hours. This part I wish every doctor explained better because it causes so much unnecessary panic and can actually negatively impact the outcomes of these injections. For the first 24 to 48 hours, there's a chance your pain will actually get worse. It's called a post-injection flare, and research shows it happens in somewhere between 1 and 18% of patients, depending on the type of injection. If it happens to you, don't freak out. You didn't damage anything, the injection didn't fail. What's happening is the volume of fluid we injected is temporarily increasing pressure in an already inflamed area. Plus, the steroid itself can sometimes cause a brief inflammatory reaction before it starts working. Here's what a 2024 study found. They followed patients every 3 days after their injection. On day 1, about 73% of people who obtained longer-term relief felt better immediately, but some of these people's relief faded by day 4. The key finding? If you're going to respond well and have long-term benefit, day 4 is when you can usually predict it, and day 7 or 10 really locks it in. So in practical terms, the steroid takes about 3 to 7 days to really kick in. So during that first 24 to 48 hours, here's what you should do. Use ice packs on the injection site 20 minutes at a time, 3 or 4 times a day. Gentle movement is good, short walks, easy stretching, but avoid anything strenuous. Take your regular pain meds if needed. Just no heat on the area for at least 3 days. Heat can actually increase inflammation and interfere with the steroid's effectiveness. If you're diabetic, know that the steroid can temporarily spike your blood sugar. Check your levels more frequently for the next 72 hours and adjust your medications as needed. Most people start feeling legitimate improvement around day 3 or 4. By week 2, you should have a good sense of whether it worked. Last thing but not least, track your progress. Your memory of pain is surprisingly unreliable. 2 weeks from now, if I ask you how much better you feel, you might not be able to remember exactly how bad it was before. So do this. Starting the day before your injection, rate your pain every day on a scale of 0 to 10. Track your mobility. Can you walk further, sit longer, sleep through the night better? Write it all down. Use your phone, a pain journal app, whatever really works for you. Here's why this matters. Insurance companies often require documentation that you had at least 50% pain relief for at least 3 months before they'll approve another injection. Without good records, it's your word versus, well, nothing. Plus, your doctor needs this information to decide the next step. If the injection worked, we know we're targeting the right area. If it didn't, maybe we need to try a different level, a different approach, different steroid, or consider other treatments. Tracking helps you understand if you're in that group that responded, or if we need to pivot to plan B. One more thing, you'll probably have a follow-up appointment scheduled for 2 to 4 weeks after the injection. Bring your pain diary. It makes those appointments much more productive. If you want to go deeper into the actual research behind these injections, the stuff your doctor might not have time to explain in a 15-minute appointment, click right here. My next video breaks down the top 5 most interesting facts about epidural steroid injections for sciatica. It covers things like why some people respond and others don't, what the studies actually say about success rates, and some lesser known truths that might surprise you. And if this video helped, hit the like button and subscribe. I make evidence-based pain management content every single week. Thanks for watching, and I'll see you in the next one.